Secondary examination. In order to obtain precise information as to the condition of the anterior urethra, one must use an exploring instrument. I usually employ a 26 French sound. The meatus may have to be cut. If this is grasped, there is stricture. If it is not grasped but brings blood, not from the meatus, there is anterior urethritis. The precise surface conditions of both anterior and posterior urethra are determined by urethroscopy, see chapter 21, the bulbous bougie, footnote, this is an instrument I do not employ. The largest bougie that will pass the meatus is lubricated and passed gently into the anterior urethra. As it advances, the physician notes the position of every obstruction and even of every sensitive spot encountered. When it is just entering the bulbous portion of the canal, it is withdrawn and the obstructions encountered verified as the instrument passes over them again on its way out. The bulb is then carefully examined and wiped off to discover traces of blood or pus upon it. It is then reintroduced rapidly to the bulbous urethra and, aided by firm counter pressure on the perineum, insinuated into the membranous urethra. By this examination, we distinguish any stricture or erosion in the anterior urethra and locate it with considerable accuracy. For an efficient examination, the bulb must be 26 French in size. Any meatus too small to admit this must be cut. Page 767. A 26 French bulb detects infiltrations that do not perceptibly encroach upon the caliber of the urethra. If the bulb detects nothing, an anterior urethritis is nevertheless suspected. Its presence is shown by urethroscopy. Contraindications to the method. Acute relapses or complications, e.g. in prostate or testis, prohibit instrumental examination until they shall have passed. Inferences drawn. The diagnostic horizon is not limited by physical signs. We find by our examination that the patient has this, that, or the other lesion. Indeed, we usually find that he has several lesions. But before the diagnosis is really complete, we must know which is the predominant lesion and what part the patient's general condition plays. Our examination reveals, let us say, prostatitis, anterior and posterior urethritis. Under these conditions, we may feel confident that one of these lesions is more important than the others, is indeed the underlying lesion that keeps the others going. It may be that prostatic massage alone will cure the case promptly and permanently, or maybe posterior irrigation is required, or perhaps any attack of the posterior urethra does harm, and the patient will recover on an interior injection, or dilatation may help, or any local treatment may irritate. These are not theoretic possibilities, but practical facts. Diagnosis of the lesion is necessary, but an absolute therapeutic conclusion can rarely be drawn from that diagnosis. We must feel our way and try first one treatment and then another. Concerning shreds. The purulent urine of acute urethritis does not contain shreds, but as the inflammation subsides and tends to become localized, little scabs form upon the more inflamed areas and are washed away in the urine. These are called shreds, trypophaton. They consist of a mass of mucus or fibrous matter entangling pus and epithelial cells. To the general practitioner, shreds simply mean that the general inflammation is subsiding or has subsided. When, day by day, the urine shows less pus and more shreds, conditions are improving. The following general observations concerning shreds seem warranted. 1. Shreds are no index of gonorrhea. They are currently found in the urine passed by men who have never had gonorrhea. 2. The shape and size of shreds do not indicate what part of the urethra they come from. 3. Shreds mean chronic localized inflammation of the urethra. 4. Shreds heavy with pus sink rapidly in the urine. They indicate relatively active inflammation or ulcer or stricture. 5. Lighter shreds often testify to an inflammation so mild that it presents no dangers and is entirely uninfluenced by treatment. 6. Shreds call for treatment by dilatation or urethroscope, unless this irritates.